Hey everyone, welcome back. Ready for another deep dive. Today we're tackling something I'm sure we've all experienced, abdominal distension.
Yeah, that bloating, that feeling of tightness. Not exactly the most comfortable sensation.
Definitely not. We've got a super interesting source for this one, an article originally written in Arabic.
Ooh, interesting.
Yeah, it takes a look at the causes of distension, how it's diagnosed, and even some remedies you might not have heard of before.
I love that we're getting such a unique perspective on this.
Me too.
Hey.
But before we get to the remedies, let's start with the basics.
Right, the foundation.
What exactly is abdominal distension?
Basically, it's a noticeable swelling or enlargement of the abdomen. And the key thing to remember is it's a symptom, not a disease in itself.
So it's like a warning sign.
Exactly, like that check engine light on your car's dashboard.
Makes sense. So it's telling us something's up, but we need to figure out what's causing it.
Right.
So what are some of the usual suspects behind that uncomfortable swelling? What does the source say?
Well, it starts with the everyday culprits we all know. Gas, constipation, overeating.
Yeah, we've all been there. Especially after one too many slices of pizza, right?
Oh, yeah, for sure. But the source also points to digestive disorders, like IBS and lactose intolerance.
Right, those are becoming more and more common these days.
Yeah, definitely things to keep in mind.
Now, what about some of the less obvious causes? The article mentioned a few things that really piqued my interest.
Oh, yeah. Like what?
Well, one was fluid accumulation. Ascites, I think it's called.
Ah, yes. That one can be serious. Could be a sign of liver problems, kidney issues, even certain types of cancer.
Wow, okay. So distension isn't always just a minor annoyance.
Nope, definitely not.
What other potential causes should we be aware of?
Well, for women, ovarian cysts or fibroids can also cause abdominal swelling.
Oh, right, of course. And then there's pregnancy, especially in the later stages.
Yep, definitely a common one.
Okay, so we've got a whole range of possibilities here. How do we know when it's time to see a doctor?
Good question. The source highlights some red flags that should never be ignored.
I'm all ears.
Things like severe or persistent pain, fever, blood in your stool.
Okay, those sound serious.
Yeah, and vomiting that looks like coffee grounds. Sorry for that visual. Unexplained weight loss, shortness of breath, or any symptoms of shock.
Definitely situations where you don't want to wait it out.
Exactly.
Now, let's say you're experiencing distension, maybe with some mild discomfort, but no red flags. What steps would a doctor take to figure out what's causing it?
Usually it starts with the physical exam. Your doctor will want to feel your abdomen, check for any tenderness, masses, or fluid buildup.
So getting hands-on.
But imaging is also crucial. We're talking ultrasound, CT scans, x-rays.
Right, to get a peek inside.
Yep, help visualize the organs and identify any abnormalities. Blood tests might be ordered too.
To check for things like infection or inflammation.
Exactly. Sometimes, though, those pieces aren't enough.
I was just thinking that. What happens then?
Procedures like endoscopy or colonoscopy might be necessary.
I've heard of those. That's where they insert a tube with a camera.
Yep, into the digestive tract to get a really detailed view.
Okay, makes sense. So once the cause is identified, what are the typical treatment options?
Well, it really depends on what's causing the distension.
Makes sense.
Often, lifestyle changes, especially dietary modifications, are the first line of defense.
So like avoiding gas-producing foods.
Exactly. And identifying any food sensitivities can be huge.
Yeah, sometimes the simplest solutions are the best. But what if those lifestyle changes aren't enough?
The medications can also play a role. Antacids, laxatives, diuretics for fluid buildup.
Right.
And if an infection is detected, antibiotics would be the go-to.
Okay, so diet, medication. What about more serious interventions?
In some cases, medical procedures might be needed. Draining excess fluid, addressing blockages.
Right.
And if a tumor or hernia is the culprit, surgery might be recommended.
So we've got a pretty thorough overview of those conventional approaches. But what really caught my eye in this article were some of the more unique perspectives it offers.
Ugh, the alternative stuff.
Exactly. I think this is where things get really interesting for our listeners, especially those who are into wellness and alternative therapies.
Yeah, for sure. I was fascinated by some of these suggestions, too.
Like what? What really stood out to you?
Well, for example, the source mentions fasting, both intermittent fasting and fasting for spiritual or health reasons, as a way to potentially impact the digestive system positively.
Fasting. That's definitely a hot topic right now. But how does it tie into relieving abdominal distension?
There are different types of fasting, of course, and the source doesn't go into detail about specific regimens.
Right.
But generally speaking, when you fast, you're giving your digestive system a break. could help regulate gut bacteria and reduce inflammation potentially.
Okay, so it's about giving your gut a chance to reset. I see the connection there.
And then there's this one. You ready for this?
Hit me.
Cold water body washing.
Wait, cold showers? You're
Yes.
kidding, right?
Nope. The source actually suggests that cold showers can improve circulation, reduce minor inflammation, and even stimulate digestion.
Cold showers for digestion. That's a new one for me.
Right. Definitely a bit out there, but we'll dig into the science behind that later.
Okay, I'm intrigued, but a little skeptical too.
Understandable. And guess what else?
More surprising suggestions.
Yep. The source emphasizes the importance of sun exposure.
Sunshine.
Yeah. It links sunlight to improved vitamin D levels, which are essential for gut health. Plus, sunlight can boost your mood, regulate sleep, all factors that could indirectly impact digestion and potentially reduce distension.
Okay, I'm starting to see the connection.
Right. And then there's honey
Honey,
for distension.
particularly Manuka honey. The source really highlights this one.
Interesting. Why Manuka honey specifically?
It's known for its effectiveness against H. pylori bacteria, which is often linked to digestive issues. And it has potent antibacterial and anti-inflammatory properties that could help soothe the gut.
Huh. So it's not just about the sweetness. Nope. The source suggests having a spoonful on an empty stomach, mixing it with warm water, or even combining it with ginger for an extra digestive boost.
Okay, that's pretty easy to try. Any potential downsides to be aware of?
The source does mention that too much honey can spike blood sugar, and some people might be allergic to it.
Right, good to know. So we've got fasting, cold showers, sunshine, and honey. Quite the eclectic mix. I'm definitely getting a lot to think about.
Me too. But before we get too carried away with these alternative remedies, it's important to remember what the source emphasizes at the end.
Yeah, what's that?
While these approaches might provide symptom relief, effectively treating distension requires addressing the root cause with professional medical guidance.
That's crucial. These remedies might be helpful for managing symptoms, but they're not a substitute for proper diagnosis and treatment.
Exactly.
But this is just part one of our deep dive. We've still got a lot more ground to cover, including a closer look at those surprising approaches and what the science says about them.
Definitely a lot more to unpack. Stay tuned. Welcome back to our deep dive, everyone. Before we go deeper into those alternative approaches, I'm curious, what stood out to you as the most surprising suggestion so far?
Honestly, the cold showers, I don't know, it seems so counterintuitive. I love a hot shower, especially for relaxing.
I hear you. A cold shower is not exactly what you think of when you're feeling bloated, but the source mentions the vagus nerve, and that's where things get interesting.
Vagus nerve. Now remind me what that does again. It controls your breathing and heart rate, right?
It's definitely involved in those, but it also has a direct connection to your gut.
Oh, right. Like a communication highway between your brain and your digestive system.
Exactly. It helps control things like gut motility, basically, how well your food moves through your intestines, and even the production of stomach acid.
Okay, so how do cold showers fit into all of this?
Well, some people believe that the shock of cold water can stimulate the vagus nerve.
Like a jump start.
Yeah, something like that. And that stimulation, theoretically, could improve digestion, reduce bloating, and discomfort.
So it's not the cold water directly deflating your belly, but it's maybe triggering those neurological responses.
Exactly. But I do want to say the research on cold showers and digestion is still pretty limited.
That's fair. It's not a cure-all.
Right. And more studies are needed to really understand the long-term effects and how it might work differently for everyone.
So definitely not something to try without talking to your doctor first.
Agreed, especially if you have any health conditions.
What about the other approaches? Is there any science to back those up?
Let's talk about fasting. The source mentions it as a potential way to positively impact the digestive system.
Right. But there are so many different types of fasting. When I hear fasting, I think of like those multi-day fasts for religious reasons.
Yeah, it doesn't specify, but it seems to be talking about fasting more broadly as something that benefits the body. Intermittent fasting has become really popular lately, and there's more and more evidence it can be good for your gut health.
Oh yeah, intermittent fasting, that's where you eat within a specific window each day, like the 168 method.
Exactly. There are variations, but it's all about giving your body breaks from digestion.
Right, right. But how does that help with distension? Does it shrink your stomach or something?
Not quite, but research shows that intermittent fasting might help regulate your gut microbiome.
Wait, gut microbiome. Refresh my memory on that word.
Basically, all the bacteria and microorganisms that live in your digestive tract. It's super important for your overall health, and when those microbes are out of balance, it can lead to a bunch of problems, including bloating and distension.
So if intermittent fasting helps create a more balanced gut microbiome, that could mean less gas and bloating.
That's the idea. It's not a quick fix, but it could be good for long-term gut health. Although more research is definitely needed, especially for different people and different fasting routines.
Right. Always good to consult with a healthcare professional before making big changes.
Definitely.
Now, what about sunshine? The source mentioned a link between sun exposure and gut health, didn't it?
It did. And it all comes back to vitamin D.
Ah, vitamin D essential for so many things.
It is, and studies have shown that vitamin D deficiency is linked to an increased risk of inflammatory bowel disease, or IBD, and other digestive disorders.
So getting enough vitamin D could help prevent some of the conditions that can lead to distension.
Exactly. And sunlight is one of the best ways to get vitamin D, but you can also get it through food and supplements.
Soaking up some rays for a healthy gut. But like you always say, moderation is key.
Absolutely. Too much sun can be harmful to your skin.
Let's move on to honey. Specifically, Manuka honey, which the source seemed pretty excited about.
Honey has been used medicinally for a long time, and science is starting to uncover its potential benefits for gut health. One key factor is its prebiotic content.
Prebiotics, those feed the good bacteria in your gut, right?
They nourish those beneficial microbes that keep your digestive system running smoothly.
And Manuka honey is particularly special because...
Well, it has high levels of this compound called methyl glyoxal, or MgO, which is a powerful antibacterial.
Ah, that explains why the source highlighted its effectiveness against H. pylori. But does Manuka honey actually relieve distension?
We need more research on that specific area, but some studies suggest that Manuka honey can inhibit the growth of bad bacteria in the gut, which could potentially reduce gas and bloating.
So it's not a miracle cure, but could be a helpful part of a gut-healthy diet.
Exactly.
And just to reiterate for our listeners, these alternative approaches are best used alongside conventional medical treatment, not as a replacement.
Definitely. If you're having persistent or bothersome abdominal distension, talk to your doctor for a proper diagnosis and treatment plans.
Good point. Now, before we wrap up part 2, did we cover all of the alternative approaches the source mentioned? We've covered so much already, from overeating to cold showers. Is there anything else in the source we haven't talked about yet?
Actually, there is, and it's a little different. The source brings up the mind-body connection.
Mm-hmm.
You know, how stress and your emotions can affect your digestion.
Oh, the mind-body connection. I'm always fascinated by that. But how does stress lead to abdominal distension? We've all felt butterflies in our stomach before, like a presentation or something, but can it really be that powerful?
It's more than just butterflies. Chronic stress can actually mess with the balance of your gut microbiome. Those stress hormones, like cortisol, can directly affect things like gut motility, how much inflammation there is, even how permeable your gut lining is.
Hold on, gut motility and permeability, can you explain those?
Sure. Gut motility is basically how well food moves through your intestines. When it's working right, everything's smooth. But stress can make things sluggish, constipation, or make things move too fast, and then you have diarrhea. And permeability is how easily things pass through the lining of your gut. Increased permeability, sometimes called leaky gut, can allow things into your bloodstream that shouldn't be there, and that causes inflammation, bloating, all sorts of things.
So stress basically makes our guts more sensitive.
Yeah, exactly. And then it becomes a vicious cycle. Stress causes digestive problems, and then those problems cause more stress.
Ugh, a never-ending loop. So what can we do about it? Is meditation the answer?
Meditation can definitely help manage stress, but the source takes a more holistic approach. It says we need to create a lifestyle that prioritizes well-being.
So it's about making lasting changes, not just quick fixes.
Exactly. Stress management, exercise, good sleep, healthy relationships, creating an environment where your gut can be happy.
Makes sense. This deep dive has been so interesting. We've covered what causes abdominal distension, looked at medical approaches, and even learned about some alternative remedies.
It's been quite the journey.
The biggest takeaway for me is that it's all connected.
I agree. Our bodies are complex. To find the root cause, we need to look at the bigger picture and how everything interacts.
Now, before we wrap up completely, I have a question for our listeners. Thinking about all the causes of distension we've talked about, what lifestyle factors or habits might be contributing to yours? Stress, diet, sleep, something else. Take some time to think about your own experiences and see if there are any positive changes you can make to improve your digestive health.
And remember, if you're struggling with persistent distension, don't hesitate to reach out to a healthcare professional for help.
Couldn't agree more. Knowledge is power, especially when it comes to our health. Thanks for joining us on this deep dive into abdominal distension. Until next time, stay curious.